Hi, it's your psycho buddy. Going to therapy is getting professional advice in how not to be a jerk to yourself or anybody else. And if I had my way, then it would be subsidized for everyone, if not mandatory for everyone, to get professional advice in how not to be a jerk to ourselves, first of all, and also to others. Because once we're not a jerk to ourselves, we don't have the same need to be a jerk to others. Um, you come in to the therapist's office, you pick a seat, and then there are lots of different kinds of therapy, but most of them just involve talking, where you say what you want to say. My philosophy is it's like going to the doctor. If you lie to the doctor, why'd you bother going? Like, they can only help you as far as you're honest with them. And the same is true with the therapist. If you go there and you stare at the floor and don't say anything, they can't help you. If you go there and like crack open your soul, maybe they can a little. Um, one so the intake day is different from a normal therapy day. The first day you go in, there's a lot of questions to answer. And this is where I have a whole different video about the magic question. This, for me, when I do intake with a therapist, I ask them questions. So I interview therapists on the first day because something that is really important is that you're hiring them and it needs to be a good fit. More than anything, more than how skilled they are in whatever type of therapy, which is called a modality, whatever modality they use, more important than them being skilled is you guys having a good therapeutic relationship. And that means you jive, like they feel right. This person feels like somebody that you could learn from. And for me, it needs to be someone whose advice I can take. And for me, again, that means I need to want, they need to be the type of person that I want to be, which is a lot to ask. And because I'm very intellectual, I need someone who can tell me the the neurological underpinnings for things. Like I need someone really smart, um, and then how directive a therapist is can also vary. That means whether or not they tell you to do stuff. Some people like to have homework to work on. Some people like to have homework to procrastinate and not do. Um, there are a lot of different, as many different styles of therapists as there are people, and it's not like medicine where or being a doctor where they go through school and they know everything they need to know, they study up to be sure they stay current on what they need to know, and then you come to them and they give you the same answer that another doctor in their position would give you. It's not like that. It's a relationship. And that's why it's so important that you pick somebody that fits, because otherwise it's a waste of your time, your money, your effort. And it's a lot of like, if you've never done therapy before, obviously I fully recommend it. And getting started with a therapist is a lot because they ask you the questions about, well, did you go through trauma? Yes. What kind of trauma? Well, usually they're pretty gentle about it because actually from the therapist point of view, it's hard to hear traumatic stories a lot too. Um, but it's a big investment of energy to get on board with the new therapist, and that's why it's really important that you be sure that the one you're working with is one you feel like you can really get along with well. I think that's it. The insurance requires that you have a diagnostic code, so they will give you, you will already have a diagnosis before you go to the therapist. But they'll need that in order to bill Medicaid or whatever you're on. The way to get the most out of therapy, I think I'm going to do a whole nother video on, but I would say it's to think before you go in there about how you want to use the time that day and what you want to talk about, because your therapist probably is not going to have an agenda. They're going to come at it as, I'm going to work with whatever is up for this patient, for this client. So you need to do some thinking about what is up for you and that you need help with in order to make the most of it, instead of just like going in there like, I don't know, you're the expert, tell me what to do. It doesn't really work like that, because you're the expert. You're the one who knows what's going on in your system. If you are having symptoms that you think deserve to put you in a mental hospital, like if you're talking to voices or whatever, then, but you are not an imminent harm to yourself or others, you cannot be locked up. So don't worry about that. It's good. I always ask my therapist about, specifically about the difference between spirituality and psychopathology, because for me, the way that my spirituality looks very psychotic, my daily thought looks very psychotic. So I need someone who's not going to get afraid and lock me up. It's a big fear of mine, getting locked up. But if you legally, you have to be a threat, an imminent threat of harm to yourself or others in order for you to be involuntarily hospitalized, put on a hold. So if you're not a danger to anybody, then talk to those voices, or at least don't feel bad about it.